Hello everyone! Welcome to Public Health Buddies, demystifying public health through stories.
Public health. Haven't we been hearing this term a lot nowadays? Especially after the advent of COVID 19. What exactly is public health? Does it have something to do with the clinical medicine? Or is it more than that? Let's find out through today's story. This is Ramesh, a 45-year-old vegetable seller who travels around a lot. 2 days after he was tested positive for COVID 19, he was hospitalized due to severe symptoms like breathlessness, but then died today at the hospital. So the experts gathered to assess the cause of this event. His doctor said,
Well, we did our best, but we couldn't revive him as his air sacs were filled with fluids leaking from the tiny blood vessels in the lungs, leading to shortness of breath, followed by acute respiratory distress causing lung failure. So, in my opinion, it was COVID which failed his lungs.
taking the lead from the clinician, the epidemiologist said,
Well, we know Ramesh was a smoker, a diabetic, as well as a hypertensive case. Because of limited time, he never visited the doctor. Therefore, all his parameters were haywire. Also, due to high transmissibility of this virus, we see people with comorbidities suffering the most. So the COVID infection coupled with his risk factors leads to Ramesh's demise.
and then the social scientist contemplated further and stated,
Ramesh lived in a crowded little slum where the number of cases were very high. In spite of the lockdown, he had to go out and sell vegetables to sustain his family. The concept of social distancing was a luxury which Ramesh could not afford. Not only this, the lack of awareness and access to masks and sanitizer further made Ramesh vulnerable to contracting the infection. As he could not afford proper health care post-infection, he therefore died of the medical condition which was worsened by his poverty.
now the protagonist of our story, a public health expert. Any guesses for what she could have said? Let's not keep you waiting. Agreeing to what all of them stated, she adds,
Indeed, you all are correct. Just to add, besides the infection, risk factors, and his poverty, the frail healthcare system which was inaccessible to him, where he also had to pay out of his pocket to get the services at the time of need, made it a difficult bet for Ramesh to survive this event.
So friends, did you see how public health combines the science of medicine and epidemiology to assess the population level dynamics of the disease on one hand, and also encompasses the various determinants of health present in the society on the other hand? Keeping equity and rights at the core of its approach, public health envisions to create robust health systems which will deliver effective health services. The primary focus is on disease prevention and health promotion, followed by access to timely diagnosis, cure, and rehabilitation services through a well-functioning health system. Also, the health systems must be able to sustain the expenses while protecting the poor people from further going into extreme poverty due to health-related expenditures. In a nutshell, we may say that public health looks not only at the immediate cause of the health issue, but the combination of causes and the causes of causes. And that is where it becomes a very broad, integrative discipline which makes the understanding of health and disease much more holistic than any single branch of medicine.
That's all for today, guys. We'll see you all next week for a new story around public health. Until then, take care, stay safe and healthy. Don't forget to follow Public Health Buddies for more such stories.